All right, thank you very much. Thank you for inviting me to speak at this HAC Aotearoa. So today I want to talk to you about some work I've been doing over the last 10 years in robots, in particular in healthcare. So I work as part of the CARES group, so this is the Centre for Automation and Robotics Engineering Science. So this is based at the University of Auckland and is a multidisciplinary group led by Professor Bruce McDonald in electrical and computer engineering. And the other vice chair of this group is Dr. Ho-Suk Ahn, who you can see in this photo. So we do work as a multidisciplinary team. We've got engineers, we've got computer scientists, we've got pharmacists, nurses, doctors, psychologists as well. So we work together, and what I'm going to talk to you about today is some research that we have done on robots to help patients manage health and illness. So these, it's, I guess, looking at the patient point of view. Some work looking at robots and the role they have as companions. Some research that I'm really fascinated in is how we can improve rapport between patients and robots. And then I want to look at the future of artificial humans and their role in healthcare. So a lot of people get their ideas about robots from science fiction movies. So this can induce fear of the robot apocalypse, or that creates unrealistic expectations. So this is from Big Hero 5. It's a healthcare robot which has got far greater skills than real robots do. And this is another movie, Robot and Frank, where even though the robot was based on Asimo, which is a real robot made by Honda, the robot in the film had far greater capabilities than the real robot does. So in reality, this is the most popular robot that we have for healthcare in terms of social robotics. So this is Paro, and Paro is a companion seal. So it's like a pet robot, and you pet it and it provides companionship. So we have done several studies with Paro here in Auckland with older patients, including those with dementia. So I've got a video clip from a few years ago where you'll see people interacting with Paro.
The next generation of rest home companions have been rolled out. The high-tech robots are touted as having serious health benefits for the elderly by mimicking real-life pets. Max Banya got to meet them.
It didn't take long for these new rest home companions to earn the residents' seal of approval.
I find it quite relaxing.
Very comforting and very soothing.
The robot, known as Paro, introduced to Auckland's Selwyn Village today.
Yeah.
Research suggests the cuddly creature helps lift spirits and encourages more interaction with others.
We did a randomised trial a couple of years ago and found that the robots could reduce loneliness in people in the rest home and in the hospital.
Residents felt more relaxed, and as a result of that, physiologically, blood pressure was shown to be lower.
Paro's inventor has spent 2 decades honing his creations to resemble household pets, but without the ruckus.
They interact with Paro as like interacting with baby or real baby seal or some like previously owned dog or cat.
Beneath the soft, cuddly and, dare I say, cute exterior, there's some very cutting-edge technology that generates hundreds of different movements in response to external stimuli. And just like a real pet, I'm completely covered in fur.
Healthcare robots are nothing new, but most provide health services like reminders to go to the doctor.
These companion robots so far have been the most successful, but in the future we might see some more service-oriented robots trying to help people to manage their own health conditions.
And if you fancy a bit of early online Christmas shopping, just don't expect to see change from $7,000. Max Banya, One News.
So Paro has been sold to many different rest homes worldwide, so more than 5,000 have been sold. And there have been, since our trial, other trials showing that Paro can reduce depression and agitation in patients with dementia. Our own trial showed that Paro could reduce loneliness and blood pressure when people were patting it. Paro has also been shown to increase social interaction. So a lot of people are worried that if you give somebody a robot, it's going to take away human-centered care, whereas we found that people talk to each other about the robot, so that actually increased social interactions. And we also showed that when people were interacting with Paro, they were more likely to smile than if they were doing other activities, like playing bingo. Paro is now an FDA medically approved device, and it is funded by Medicare in the USA. So this is good because it increases the availability of Paro. So there's not very many treatments available for dementia, and so this, it looks very simple, but it's actually a very successful robotic device. Last year, the inventor Takanori Shibata came to New Zealand to receive the Ryman Prize, which is a $250,000 prize for the world's best development that enhances quality of life for older people. So Paro is not the only robot. There was a recent review of socially assistive robots for older people, which included 33 studies. With over 1,500 participants. They had 11 different robots, and 28 of these reported positive findings. And so most of these studies are reasonably small. There are not many randomised controlled trials, but there are some. And so the roles of the robots have included effective therapy, so trying to improve people's mood, trying to improve people's cognition, being a social facilitator, providing companionship, and also trying to change physiology as well, like blood pressure. So these are the robots that were used in those studies. You can see Paro up there in the top. So that's the most popular robot that's been used. There's several pet-type robots that have been used, and then there are more human-like robots that deliver the more service-oriented things like teaching people how to do exercises and motivating them to take their medication. The current projects that we're involved with include projects with Korean universities. This is a 5-year project to develop interactive robots for stabilising mood and improving cognition in patients with mild cognitive impairment or mild dementia. We also are developing robots with Korea. Again, this time the robot is for inside the patient's home, and it's for people with mild dementia. There's a wake-up scenario, there's modules on to measure mood and depression. There's modules to remind them about appointments, to check things around the house, like is the stove off, have you locked the door, the medication reminder, exercise reminder, and an emergency scenario as well. And we have shown dementia experts and older people the robot, and they've interacted with the robot, and this robot uses voice recognition, and so we're gathering their feedback about what they think about it. And it's also important to note that we do have Maori consultation on our projects as well. And the Korean partners are working on integration of the robot with room sensors. So things like you can have these mats on the floor that will sense where somebody is, as well as like room temperature, and wearables as well. We also have a HRC feasibility grant with Nairi Kurse, who's a general practitioner and head of population health, and that's testing cognitive stimulation therapy, exercises, and daily scheduling on quality of life, on sedentary time and cognition. And we are comparing a robot with a computer tablet and with just daily diaries, paper versions. So it's not only older people that robots can help, it's also children. And we recently conducted this review, which we found 73 studies with 26 different robots. And again, most of it, the research is on development and feasibility, and there are a few randomised controlled trials. And the roles for children are slightly different to older adults, but The roles include being a companion, so that is to provide comfort to children, reduce anxiety, to express empathy, and be a friend. There's also teaching roles, so this is particularly for children with things like diabetes, teaching them how to manage their condition. Also, as a therapy tool or assistant, so this might be motivating children with cerebral palsy, how to do their exercises, and then telepresence as well, which is when you might have a child who's sick at home, and so allowing them to attend school via a telepresence robot. And one of the projects we've done is helping patients manage chronic illness, and I'll show you part of this video that, of the trial that we conducted. This project is funded by the HRC as part of a partnership program in innovation, and this particular project is looking at whether the robots can reduce hospitalisations in patients with chronic obstructive pulmonary disease, which is a chronic lung condition. In this study, we are recruiting 60 patients, so they're recruited from hospital, so after they've been in hospital for a COPD exacerbation. We recruit them and then we randomise them, so half of them get a robot to take home with them and half of them get standard care. This project is across both the Faculty of Medical and Health Sciences as well as Middlemore Hospital, and also with Faculty of Engineering.
The technical challenge for us has been to put the software on the robot so that it does the functions it needs to do in interacting with people. And that's really taking some kind of medical therapy and translating it so that it runs in software on the robot.
Great, thank you for performing those tasks.
There's a lot of things that have to kind of align. It's not just one bit of software like a game or something. It has to integrate with the rest of the environment. So that's quite a challenge to get it robust enough. So those are the main challenges. Another one was connecting devices to the robot. So to do that, we need to hook a device up to the robot and program to talk to that device. And that shouldn't be challenging, but in practice actually it turns out to be more challenging than expected, because it's quite hard to get devices that are open to us connecting up to them. So we had to do quite a bit of work.
Personally, I'm amazed at how well the robot is actually getting along with our patients. The patient have taken very well to the robot. They see them as an extra companion at home, but in addition to being a companion, it actually helps them check their health status, and then it gives us the connection as a health professional to monitor them at home. So the patient absolutely loves it.
Please take 2 pumps.
When I actually got to use him and found out what he does, I was excited. It kind of changed my life.
Quite often, older people who live alone are at greater risk of exacerbations. So we hope that these robots will reduce some of that isolation.
He's very good company, and he does remind me of a lot of things, mainly my medication.
Let me know.
So I'll stop the video there. But the results of this trial, we found that people who had the robot, they had higher adherence to their inhalers compared to the control group. They were also more likely to do their rehabilitation exercises more often. And there was a non-significant trend for them to have fewer days of hospitalisation for respiratory-related reasons. When we looked at the hospital costs, they were also lower for the patients in the robot group. But one of the things I was most fascinated with was the relationship that people formed with the robot. You had a lot of people who would talk to the robot, even though the robot couldn't actually understand what they were saying. And people, when we took the robots away, people said that they missed them and that they were their friends. And so I'm particularly interested in this aspect of rapport and empathy. And so I'm interested in building empathy into robots. So that is applying communication skills and personality. And it's also about the appearance of the robot as well, because what it looks like affects our perceptions of it. So robots with big eyes and soft features are perceived as having warmer personalities than robots with small heads and more mechanical looking, which are perceived as more competent. And so I've worked, when I was up in Boston last year, I worked with Julie Shah, who's Professor of Astronautics and Aeronautics, and we were working on a model of, I guess it's like patient-doctor communication, but now we've turned it around into patient-robot communication, so that we're trying to put in the same variables, so that we have background variables such as age, gender, culture, education, what kind of disease they have, etc., along with the appearance of the robot, the voice of the robot, the gender of the robot, etc. And then we look at the consultation itself, and we look at the behaviours of the robot in terms of having, expressing communication in terms of affective and instrumental communication, verbal and non-verbal, the time they spend on relationship building, information exchange, shared decision making. They have to maintain confidentiality and yet pass on information when necessary, and social rules for appropriate medical behaviour. So building that is ambitious, but it's something that I'm interested in and I'm keen to do. And then hopefully if we get this right, then that will influence patient outcomes. So now I just want to turn to chatbots and artificial humans in healthcare. So Alexa is extremely popular in the United States, probably a little less popular here, but there are applications on Alexa for asking about medical things. So you can, through WebMD, you can talk to Alexa and say, tell me about amoxicillin, for example, what is an echocardiogram, what are the side effects of steroids, or what are the symptoms of a heart attack. So patients, or people in general, are using Alexa to ask these kind of questions. These statistics are from last year, so 20 million sold with 581 health skills. And it's moving from just providing information to actually helping patients to manage chronic illness. There's an AI diagnostic tool also on Alexa. There's the Mayo Clinic First Aid, and it's also being integrated with Fitbit. So there's a lot happening in that space. But what about the role of avatars? So avatars have been used in Second Life in terms of having these virtual rooms where people can go in to these sexual health, for example, virtual spaces where they can talk about issues with other people. There's also delivery of therapy in Second Life, such as acceptance-based treatment. Avatars have also been used in additional sessions with therapists, for example, with children with autism, to teach them how to behave in social situations. And there's also serious games, such as Sparks from the University of Auckland, where your avatar progresses through a fantasy world. And then there are some autonomous virtual agents, which are usually text-based artificial intelligent systems. Recently, there was a trial, this is from Northeastern in Boston, which was a feasibility study with 55 patients, where there was an avatar talking to patients about virtual palliative care. And so it was just a touch screen, and people interact with it that way. And the feasibility study was acceptable, and it's now been funded with $1.3 million of funding to have a full randomised controlled trial. But if you look at the quality of the avatar and the quality of the interaction is actually very simple. And now we have much more sophisticated avatars and much more sophisticated interaction systems. So recently, I've started doing some work with Soul Machines, which is a New Zealand company founded by Associate Professor Mark Sager from the Auckland Bioengineering Institute, and just have a look at some of their avatars. So these are not real people, these are the avatars. These are their artificial humans. So if you think about, the ability of these avatars to express emotions, you can think about the types of rapport that they can build with patients. There's an incredible opportunity, I think, to deliver therapies and healthcare through these artificial humans. I'm involved in helping the software to detect emotions in people through a variety of variables. But I've got a final video clip here of one of the projects that Soul Machines is involved with Lance O'Sullivan.
How do we deliver more care to more patients for less cost? The answer is through technologies like digital humans.
How are you today?
Kia ora, Doctor. Actually, I'm not feeling very well and I'd like your help, please.
That's what I'm here for.
So the project we're doing with Soul Machines is to create a digital health professional that is able to address some of the problems of health systems around the world, which is how do we create a health workforce that is fit for purpose and maybe even customised to the patient's needs. Customised in the sense of they might look, sound and feel like the patient who's in front of them.
I'm glad you contacted me then. Are you short of breath?
Yeah, I have been short of breath actually. So the real value of the technology that Soul Machines brings to a project like this is the ability for the avatar to interpret the emotional expressions of the patient sitting in front of them.
You look anxious, but rest assured your health is my primary concern.
And won't bring any judgment or bias into this consultation with you any time of the day or night.
To help my diagnosis, I'd like to run a few tests using the interconnected features on your device. Do you have your digital thermometer handy?
Yeah, I do actually.
Excellent. Can you place the thermometer in your ear?
The pressures of health systems that are operating with limited resources, where there's not enough doctors, not enough nurses and just not enough clinics to go around, are felt more acutely in communities that are remote, and also certain populations like Indigenous people.
Okay, you can remove it now. Your temperature is a little high but not alarming. Let's test your heart rate and oxygen levels using the smart pulse monitor like this one.
The opportunity here with digital health professionals is to be able to penetrate these services into those communities.
Please clip it to your fingertip and hold for 5 seconds.
So I'm passionately committed to Indigenous health.
And finally, I'd like to check your breathing patterns. Please plug the digital stethoscope into your smartphone. Then place the device on your chest and breathe deeply.
This is an opportunity to say, tomorrow we can offer you a health service that looks like your people, sounds like your people, and feels like your people.
I've processed your results and believe you have a chest infection. I sent a prescription to your closest pharmacy on Queen Street.
This is a very exciting next step in the ability for us to deliver better health services and essentially better health outcomes.
That's why I'm here.
So just to wrap up, I'd just like to say that there is evidence emerging that robots can improve health outcomes in terms of loneliness, adherence to medication, increased activity, and improved cognition. These new digital humans offer incredible realism and the potential for healthcare delivery. I think all of the technology needs further development, but at the same time, we can be testing with people to get feedback and test the effects. We need to build these artificial intelligent models to maximise the emotional connection that we have, because in a lot of mental health, it's not the actual therapy that is used that is effective, it's the connection or the rapport you feel with the psychologist that makes the difference. We need more randomised controlled trials, and we need to integrate this with clinical routines so that doctors aren't given an extra something to do, it's integrated in their care, and technical support must be provided both to the patients and the doctors. Thank you.